My name's Janice Henderson, and I'm with the Maternal Fetal Medicine subspecialty group at Hopkins. That's a part of the OB/GYN department. And a maternal fetal medicine subspecialist is someone who cares for high-risk pregnancies. And this could be high risk because the mom's high risk because of a maternal problem or a previous pregnancy problem, or there's a problem with the fetus. My role at Hopkins is really mostly that I'm a clinician. Most days you'll find me in clinics caring for patients, and sometimes you'll find me in the ultrasound unit trying to make the diagnosis of a malformation of a fetus, but most of the time I hope not to find anything on those ultrasound images because I like to give good news, not bad news. As well as being a clinician, I'm also a teacher, and I teach undergraduates, medical students, fellows, and residents. But I think first and foremost I teach my patients about how to have healthy pregnancies. Thirdly, my role at Hopkins is that of a researcher. I think we all try to balance these three roles. And my research really has to do with outcomes of pregnancy in the obese pregnant population. And at the same time, there were a lot of reports coming out about pregnant women having worse outcomes if they were obese, and also the link between maternal obesity and childhood obesity was there in the literature. So we wanted to do something about it. I teamed up with one of my colleagues and we started an obesity and pregnancy research group and actually started a clinic for obese pregnant women. When I was an undergraduate, the thing that maybe swayed me towards obstetrics, though I didn't realize it, was that I absolutely loved embryology. And I was really in awe of how complex human development was, and at the same time how often it came out right. It was really quite amazing. My philosophy of patient care is pretty simple. I really try to treat every patient like they were my daughter or my sister or my mom, or for that matter, the way I would want to be treated as a patient. I think in this specialty you have to be especially sensitive and respectful, and you have to try to always give unbiased counseling. And I think, like everyone at Hopkins, we try to give the best care possible to our patients.